Assalamu alaikum, doctor, and greetings to everyone. Today, our group will be talking about a very important and timely topic, population aging. So first, let me start with a question. Have you ever noticed how many countries now have more elderly people than ever before? This is what we call population aging. When the average age of a population rises and the number of older people increases, while the number of young people decreases. It is happening in many parts of the world, especially in developed countries, but also in developing ones, including Malaysia. So why does this happen? There are two main reasons. First, people are living longer because of better healthcare and living conditions. Second, birth rates are falling. Many fewer babies are being born. Now, you may ask, why should we care? Because population aging affects all parts of society. Healthcare systems, the economy, families, and the workforce. It's not just a statistic. It shapes our future. In today's presentation, we will explore this topic in more detail. We'll look at the key points, discuss the main issues, share some real-world examples, and finally, offer some suggestions to deal with this growing challenge.
Good morning, everyone. Today we'll be talking about population aging, a major demographic trend affecting countries around the world. And now faced the cause of population aging. There are two main causes of population aging: increased life expectancy and declining birth rates. First, as the healthcare, sanitation, and nutrition improve, people are living longer lives. This increased the number of elderly in the population. Second, many countries are experiencing low birth rates. Factors include family planning access, women pursuing higher education and careers, and urban living where raising children is more expensive. Population aging has serious implications for the economy. With fewer young workers and more retires, countries face slower economic growth and labor shortage. Governments must spend more on pension and healthcare, putting pressure on public finances. At the same time, fewer workers are contributing taxes to support the system. This shift in the age structure may reduce productivity, innovation, and increase the cost of social services. As people age, they require more medical care. So now we're facing pressure on health system. Many suffer from chronic illnesses such as diabetes, dementia. This leads to increased demand of healthcare services, medications, and long-term care facilities. In conclusion, population aging is a growth challenge that affects every aspect of society, from healthcare and the economy to families and the workplace. While the causes are clear, people are living longer and having fewer children. The solutions are complex and require coordinated efforts by government, communities, and families.
Population aging refers to the phenomenon where the proportion of elderly people in a country's or region's total population is steadily increasing. With advancement in healthcare and improvements in living standards, the average human lifespan is getting longer and mobile. As a result, the number of elderly people is growing rapidly. According to the United Nations, by 2050, the global population aged 60 and above will reach 2 billion, accounting for 22% of the total population. Population aging brings a range of social and economic challenges. Firstly, there may be a shortage of labor as the proportion of younger workers declines, forcing businesses and governments to address labor supply issues. Secondly, Social security systems come under greater pressure because of the rising costs of pensions and healthcare, which can strain public finances. Thirdly, family structures are changing. Traditional models of elder care, where children support aging parents, are increasingly changed, leaving many elderly people vulnerable to loneliness and mental health issues. In response to population aging, many countries have started taking proactive measures. For example, some governments are encouraging older workers to delay retirement and remain active in the workforce. They are also fostering the growth of industries that cater to the needs of seniors, such as elder care services and health and wellness industries. Additionally, there's growing emphasis on lifelong learning and mental health services for seniors, helping them stay aged and continue to contribute to society.
Examples of population aging. Japan is one of the most aging countries in the world, with over 29% of its population aged 65 and older. Low birth rates, labor shortages, slower economic growth, and heavy burden on healthcare and patients are major issues. As of 2023, approximately 15% of China's population is aged 65 and over, and this is expected to exceed 20% by 2035, marking a deeply aging society. Aging is more served in rural areas due to youth migration to cities. In Germany, over 22% of the population is aged 65 or older, leading to heavier patient burden. There is a growing demand for health care services and staff shortage in the care sector. Examples of solutions. Germany is gradually raising the retirement age to 67. Japan promotes the use of care robots and community-based integrated healthcare. In China, regions are developing senior universities and travel programs to enrich the lives of older adults.
Population aging is a growing issue worldwide. As people live longer and birth rates decline, the number of elderly people is rising, creating pressure on health care and pension systems. To respond, governments should promote active aging, encouraging seniors to stay physically and socially active, helps improve their health and reduce healthcare costs. Second, retirement policies need to adapt. Raising the retirement age and offering part-time work options can keep older adults engaged and pension burdens. Third, healthcare systems must be strengthened. More doctors and nurses trained in elderly care are needed to handle age-related health issues. Lastly, support for family caregivers is important. Providing training, finance aid, and time of health families care for elderly relatives without burnout. With these steps, societies can better manage aging populations and ensure that older people continue to live healthy and meaningful lives.